All right, I'm gonna do the chest percussion check off. On this, you want to check the physician's orders, make sure they have no contradictions. And on the physician's orders, you really want to make sure where the chest x-ray, where the atelectasis or the fluid buildup was to perform the chest percussion in the correct position. I guess every kind of different positions has the different positions the patient should be in to get that atelectasis or fluid buildup moving into a different location and hopefully expelled. So I checked over the patient's chest x-ray. It looks like they have some in the lower left lung is where the main buildup is. So we're going to perform the percussion so we can get it moved out of that position. All right, so before I go into the room, hello, I'm Tyler. I'm a respiratory therapist here at the hospital. We're going to perform some chest percussion today to help kind of get that atelectasis and kind of that chest or that fluid buildup in the left lower lung that you had in your chest x-ray. Usually on this, when you're getting to this stage, sometimes for, a lot of times it's used in infants since there's not a lot of other techniques or therapies that can be used. Also on any quadriplegics or paraplegics that have kind of immobility that can't perform the other therapies, this can be used on if a vest is not suitable for them. So I guess before we get started here, I can ask the patient, have you ever had this done before?
No.
If they have not had it done before, then you can explain the therapy. So what I'm going to do, I'm just going to kind of cut my hands and hit you, or I guess not hit you, just kind of tap, kind of in a rhythmic thing so we can get the fluid moving out of that portion of the lung. And I'll kind of put you in some various positions just to get it moving out. So again, it was on the left lower, so we'll kind of sit you into different positions. So let me go wash my hands. All right, I'm going to put on some gloves here. All right. Make sure you do this an hour to an hour and a half after eating. Most of the times you want to go about 3 to 5 minutes in an area. If longer, that's okay, but that's kind of what our hospital has done here. I've only seen this done about one time. If there's any jewelry, take that off. Make sure to watch out for any bony promises. And kind of maybe go around their pain schedule, their pain medication. If they have more, if they've got pain medication, maybe let it kick in, then do it, so you're not creating a lot of pain for the patient. Okay, so what I'm going to have you do, I'm going to position them. I'm going to actually, hold on, I'm going to get your vital signs real quick and listen to those breath sounds to see if anything's changing. All right, so I'm going to listen to your breath sounds. Just breathe normally for me. And again, you can hear it in this left lower portion right here. All right. And then I'll get their vital signs, the heart rate, the respiration rate. Okay, so I'm going to lay you back here. And I'm going to have you roll onto your right side. Okay. And then kind of, can you raise this a little bit more for me just so I'm kind of hitting on your back side here. So then you're just going to make rhythmic strikes for about 3 to 5 minutes. And her lung sound, or her fluid was on her lower left lobe, so about right in this area. So I'm striking here to make it move more to the right. All right. And you're just going to do this for 3 to 5 minutes. We're going to speed up the process, just saying. Making sure if they're in pain, just maybe try to do lighter, or maybe this treatment's not for them. And then I'm going to, it doesn't really work in this, but I would have them, can you just turn around for me onto your stomach? A bed would be better, not this chair. Kind of hard. And then I place a pillow. Let me grab a pillow here. There's no pillow in here. But if I was trying to get it out, I would have them kind of dipped down, kind of their head down a little bit, and a pillow under them. So I'm hitting them, I'm making the fluid go up out of their lower portion of the lung. After I get all this done, I'll have them kind of come back. All right. And just get them back into the proper position, or their normal position that they're comfortable or in. And I'll kind of have them do a little huff cough again to see if they can get anything out. So I'll have you cough for me. Okay. And then after that, if they did have sputum, you'd kind of maybe kind of note the color and if it was bloody or anything. I would make sure the position, our patient is positioned in their comfortable position, the call light close, and then kind of talk to them about when you'll come in next. Kind of on the therapy here, it's kind of different hospitals have different protocols. So say it could be 4 times a day or every 4 hours. It could be, just twice a day. So after kind of knowing that, you tell them when you'll be in next. Again, listen to their vital signs, breath sounds, and all that after the treatment. And then I can throw everything away, make sure their call light's close, they're in the right position, and you're good to exit the room. After you exit the room again, just make sure you chart everything, your before vitals and breath sounds, and after, and any changes that you've seen or the color or anything of the sputum. And then the next time you come in to perform the therapy, again, you want to look at that chest x-ray to see if there was any changes after the therapy that you have been doing, to make sure that you don't need to put them in different positions for the next time. All right.